with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and Metro Coronavirus Task Force. We're joined today by Dr. James Hildreth, President and CEO of Meharry Medical College, Taylor Gentry, a Nashville resident and COVID-19 survivor, and Metro Director of Law, Bob Cooper. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. As Metro starts the first day of school virtually, I want to wish all students, teachers, and staff and families a successful school year. Let's all work hard to flatten the curve of the virus so we can get back to school in person. Now, before we review today's COVID-19 numbers, I'd like to address several recent violations of our public health orders. My office is working closely with Metro Codes, Metro Legal, and the Public Health Department to investigate this weekend's party on Fern Avenue and those responsible for organizing it. This event was a violation of our modified Phase 2 public health order, an irresponsible act with disregard for the health of our residents and the progress that we've made in reopening our local economy. As announced yesterday, Metro Codes confirmed through the Tennessee Secretary of State's office that the organization responsible for this gathering is an active LLC operating out of 21B Fern Avenue, and Metro has posted a stop-use order on this property for illegally operating a commercial business in a residential district. We are joined this morning by Bob Cooper, Metro Director of Law, who will provide an update on our response for those responsible for the event and the legal remedies that the city will pursue in coordination with the District Attorney's Office for this illegal event. Now, there have also been several reports of transportainment vehicles still in operation despite our latest public health order, and citations have been issued along with court dates. I've met with Chief Anderson and Deputy Chief Hagar regarding the enforcement of our public health orders. The expectations of all Davidson County residents are for swift and consistent enforcement of Metro's ordinances to keep our community safe. Both lives and our economy depend on it. Now, as documented in current national headlines, enforcement of public health orders is a nationwide challenge. Nationally, few citations have been issued for violations of mask mandates and similar ordinances so far. But here, as across the nation, this is subject to more stringent enforcement. The coronavirus has given us many challenges we must solve together. We know that face coverings, social distancing, and the avoiding of crowded places slows the spread of the virus. And as I've said before, no amount of government action or intervention alone will end the pandemic. Your cooperation is needed to save lives and fully reopen our local economy. Now, last Friday, Tennessee reached a critical milestone when all 95 counties surpassed the threshold of acceptable coronavirus transmission as set by the Tennessee Department of Health. And as of this morning, 93 counties still remain above that dangerous threshold. As Dr. Hildreth pointed out late last week, 60% of Tennessee's 110,000 coronavirus cases have come in the last 4 weeks. The virus continues to surge across our state, and Tennessee is one of 4 states highlighted by Dr. Anthony Fauci as outbreak centers, a list that also includes Kentucky, Ohio, and Indiana. Now, in Nashville, however, we continue to see a hopeful trend since the beginning of our modified Phase 2. This phase is marked by the start of a countywide face covering ordinance, the temporary closure of bars, a 10 p.m. closing for restaurants, and a gathering restriction of 25. These public health decisions have recently been validated by the White House Coronavirus Task Force and are recommended by the White House Task Force for the entire state of Tennessee. This morning, Nashville is reporting just 109 new cases. Our 14-day new case rolling average is now green, down from 200 and down to only 244, from its peak, though, at 400 on July the 14th. That is a decrease of 39%. Now, during the same time frame, the state's 14-day average, without Davidson County's numbers, has increased by 51%. Our transmission rate here in Nashville has fallen from 0.96 now to 0.86, and Nashville's 7-day positivity rate is now at 11.4%, the lowest it has been since June. To all Nashvillians who are practicing healthy habits at home and at work, your efforts are making a difference. 19% of floor beds and 15% of ICU beds are currently available, and both metrics remain in the yellow caution category. As I've said repeatedly over the last several months, Nashville is not an island. Commuter patterns show that 2 out of 5 Nashville workers live in neighboring counties, and nearly 100,000 of our own residents travel out to those counties to work during the week. A regional health protocol would provide a more effective response to keep all of our residents safe. Our fate is tied to the success of our region's coronavirus response, and that is why we need more than an every county for itself strategy. This strategy also needs to address test, result delays, and hospital staffing capacity. Remember, Nashville, don't share your air. We're on the right path, but we must remain vigilant. If 8 out of 10 Nashvillians wear a mask, we can contain the virus, avoid a complete economic shutdown, and get everybody back to work. As a reminder, the Community Assessment Center at 2491 Murfreesboro Pike will be closed today. Normal operations will resume tomorrow, Thursday, August the 5th. While state regulations have precedence within polling locations, we urge everyone to wear a mask and practice safe social distancing, both immediately before and after the voting process, to help ensure your safety. This morning, it is also my pleasure to welcome Taylor Gentry, a Nashville native and student at Dillard University in New Orleans. Taylor is also the daughter of Howard Gentry, a longtime public servant and current criminal court clerk at Davidson County. Taylor is with us this morning to discuss her personal experience with COVID-19. I'd also like to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who has joined us this morning to share his well-informed commentary on the coronavirus as a renowned infectious disease expert and community leader. And now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning. Here's the latest on coronavirus in Davidson County. I first want to start by digging a little deeper into the numbers this morning. We now have 15% of ICU beds and 19% of hospital beds available in our city. There are approximately 180 people currently hospitalized in Nashville hospitals with COVID-19. Our rolling average is 244 new cases per day, and that's down 98 since last Tuesday. This is moving in the right direction. However, it still is high and needs to come down. We are averaging 27.5 new cases per 100,000 residents. This has decreased significantly from 2 weeks ago when it was 65 new cases per 100,000 per day. However, it is still in the severe category for new cases. We need to be under 25 new cases per 100,000 to be out of the severe range. When we are under 10, then we can visit family members in nursing homes. Our testing numbers continue to improve, but we are still not where we would like them to be. 11.4% of those tested in the last 7 days were testing positive. We need this number to be below 10%, and maybe even closer to 5%. The steps we took a month ago, mandating masks, going to a modified phase 2, and closing bars are working. We're seeing our metrics improve, but we're not out of the woods yet. Most of you are doing your part, so please keep that up. If you're watching today's press conference, then you know You get it. You've heard our message. But we need to reach out to those who aren't watching this morning. They need to understand how serious the situation is. We have to attack this virus as a community. It's going to take all of us. You need to spread the word, tell your family, tell your friends, post it on social media. Whatever way you need to get the word out, please do that. Let everyone know that they need to wear the mask when they go out in public. When you wear a mask, you're leading by example. You're showing that you care about the health of others. You're showing that you care about this community. Don't go out if you're sick or if you've had a test and you're waiting for your results. Don't go to parties or big gatherings. Don't hang out in big crowds. Stay away from people that aren't wearing masks. And if you feel sick or you think you've been exposed to the virus, please get tested and stay home until you figure out the results. Now, the 3 community centers are open every day as normal from 7 a.m. to 1 p.m. However, today, the site at Antioch, the old Kmart location, is closed in preparation for the elections. So they will be so today, if you need a test, go to Meharry Medical College or Nissan Stadium. But tomorrow and every day thereafter, Monday through Friday, 7 a.m. to 1 p.m., all 3 sites will be open. Now, let me address one of the most critical issues facing our cities. 7 out of 10 Nashvillians who have gotten this virus are under the age of 44. In fact, 28% of all cases are in individuals between the age of 25 and 34. Almost a third of cases are in that age group. Now, studies from other countries have shown that those under 30 played a significant role in spreading this disease in everyday settings, like going to restaurants, going to bars, going to music-related events, and workplaces. This age group is less likely to be hospitalized if they get the virus, and they're more likely to recover more quickly. But they can and do spread the virus to others. They pass it to older people, to people with weaker immune systems, to people who are more vulnerable, to people who will get sicker and stay hospitalized longer, and to people who are more likely to die. Taylor Gentry is with us this morning, and she knows firsthand that this can happen as it's happened to her family. I really am grateful for her for being here today to share her story, and we'll hear from her in just a minute. But right now, I would like to introduce Dr. Hildreth of Meharry Medical College.
Good morning, Nashville. Today I want to talk about a clinical feature of COVID-19 that further demonstrates the unique nature of the virus and the disease it causes. The phenomenon has been called happy hypoxia by clinicians, but it's been given the official name of silent hypoxia. As we all know, oxygen is essential for life, and the human respiratory system has evolved as an elegant machine to make sure that oxygen can be extracted from the blood efficiently and carbon dioxide can be removed. The system consists of a nose, which is connected to the pharynx, which drops into the larynx, which connects to the trachea. The trachea is a large pipe in front of the esophagus. It branches into bronchi, one to the left, one to the right. This branching continues until at the very end, there are these small sacs at the bottom called alveoli. When we inhale and take in air, these sacs become filled with air, and then red blood cells flow through the sacs and capillaries to take up oxygen and release carbon dioxide. The oxygen content of blood is closely monitored by organs called chemoreceptors that are found in the blood vessels in our neck that take blood up to the brain. And if the oxygen levels in blood drops, a signal is sent to the brain, which causes us to respire more rapidly, to take deeper breaths, and in some cases, to have the heart rate increase as well. So low oxygen levels can result in confusion, anxiety, rapid rates of breath, deep breathing, and loss of consciousness. So the signs of hypoxia are not subtle, and they're clearly well-defined. So many patients who develop COVID-19 will turn up in the emergency room or clinics after a COVID-19 positive test, and the clinicians are astounded because their oxygen levels are so low that in some cases they seem incompatible with even being alive. This is why it is called silent hypoxia. These individuals have dangerously low oxygen levels without any of the usual signs that this is the case. And while this phenomenon is not completely understood, recent insights tell us this. Normally in pneumonia, the air sacs become filled with fluids, and that prevents the oxygen from being taken up by the red blood cells. Well, it turns out in COVID-19 early on, they don't become filled with fluids, they simply collapse. And the collapse of these air sacs prevents oxygen being taken up. But apparently carbon dioxide is released normally, and the brain is confused and doesn't send the signals it would normally send. So, it appears to be the case that if we could detect these low levels of oxygen early on, the hypoxia early on, that might prevent people from needing to be intubated or treated on ventilators. And that's where this little device comes in. It's called a pulse oximeter. And this is mine. It looks like a chubby little clothespin, and it's very inexpensive. You can find them anywhere. You turn it on, you squeeze the back of it, the mouth opens, you stick it on the end of your finger, and in a few seconds, it will give you the results. Well, there it is. So mine says 99% oxygen saturation, heart rate of 58. So normally, you want your oxygen saturation to be higher than 95%, which is ideal. Below that, there's reason for concern. Now, because people have different health levels and different underlying conditions, your normal saturation might be less than 95. The point is, you get one of these, you measure it on a daily basis to establish your baseline, and then what you're looking for is a drop from your personal baseline. If it drops more than a few points, that's an indication that you see your healthcare provider to make sure that everything's okay and to rule out COVID-19. And many clinicians believe that if we catch the hypoxia early on, we wouldn't have to put people on ventilators, they would not need to be intubated, and a lot of the function of the lungs could be preserved. And given the prevalence of the virus now in our communities, I'm recommending that if you belong to a high-risk category, that you get one of these, and on a daily basis, you monitor your oxygen saturation, and if it drops, please seek out a healthcare provider to make sure that everything is okay. And that would actually save lives and save people from being treated in ICUs and on ventilators. Nashville, we got some green boxes on the board now. That's really good. Let's keep those boxes green, and let's go for 6 out of 6. So we got this. Please don't be a vector, be a hero, wear a mask. And with that, I'm pleased to introduce Taylor Gentry.
Good morning, Nashville. I am Taylor Gentry, daughter of Criminal Court Clerk Howard Gentry and School Board District 1 Representative Sharon Gentry, and I'm also a survivor of COVID-19 virus. I'd like to tell you a little bit about my experience today. I am a student at Dillard University in New Orleans, and many people, many of my peers know that back in March, our spring semester ended abruptly, and we were to come home and be home for quite some time. When we first got home, we know that the city was shut down. There was curfews, everything was closed, social distancing was easy to practice. At a certain point in May, the city began to reopen, the country began to reopen as a whole. And I can admit that myself, I got a little comfortable. I stopped wearing my mask, I went out, I went to the bar, I went everywhere. And I also suffered a loss of a friend. And with that, I would love to be around my peers, so we were throwing parties, going to each other's houses, of course, funeral services as well. I did get sick shortly after all of those events took place. I suffered from a fever and everything that came with it for one day. 2 days after that, I had a doctor's appointment, and I told my doctor everything that happened, and he suggested that my dad and I both go get tested because we do live in the same house, and he was also beginning to feel sick as well. That same day, we went straight to Meharry Medical College, sat in the line, and we got tested for the COVID virus. A couple of days later, we both received our positive results. During our experience with COVID, it was very hard. It was very hard for me to watch my dad more than anything. Since he is a lot older, he was hit very hard. Almost every symptom of COVID that's listed on the paper that you get after your test, he did have. It was hard for me as well. Having no taste and smell is not fun, and being tired all the time is no fun either. I want to let my peers know that you are not immune to this disease. Whether you're 20, 19, 18, or lower, you can get it just as much as the next person. We need to do our part. As far as the party that happened last weekend, that was unacceptable. It shouldn't have happened, and I know that there were my peers in attendance. We know better. Nobody had on a mask, and nobody was practicing social distancing. As far as the activity downtown, if you choose to visit downtown or if you choose to come into Nashville, wear your mask. There are signs downtown that say that they are required of you. If you don't want to look out for yourself, at least protect the people that are around you. This is our new reality, and we have to get adjusted to our new normal. So do your part, wash your hands, wear your mask, and please practice social distancing so we can get back to life as we used to have it. Thank you.
Thank you, Ms. Gentry. I'd now like to introduce Metro Director of Law, Bob Cooper.
Good morning. Metro's Chief Medical Director has issued multiple orders over the last few months that are essential to preventing the spread of COVID-19 and protecting the health and safety of our community. These orders impose a number of personal and business restrictions, which include prohibiting crowd sizes of more than 25 people at any private gathering. Metro Legal, the District Attorney's Office, and the Metro Nashville Police Department are working together to investigate reports of an event Saturday night on Fern Avenue in East Nashville that appeared to involve significant breaches of these critical orders. Under Tennessee law, anyone violating the Chief Medical Director's orders commits a Class C misdemeanor, which can be punished by up to 30 days in jail. If the investigation shows that the organizers of Saturday night's event violated these orders, the District Attorney's Office, in consultation with Metro Legal, will pursue all available remedies. If any member of the public has information that might be useful to this investigation, please send it to us by submitting a Phase 2 violation report on Metro's COVID-19 response webpage. Thank you.
Thank you, Mr. Cooper. We'll now begin taking media questions. Let's start with Damon Mitchell at WPLN. Damon.
Hi, Chris. I have two questions. The first is for Dr. Caldwell. Dr. Caldwell, have you considered revising the mask mandate or any of your other orders to cut down on some of the exemptions that are sort of making it difficult to enforce? And then for Mayor Cooper, at what point do you feel that it would be no longer safe to keep businesses on Lower Broadway open? And are you considering shutting down Lower Broadway again?
Thank you, Damon. We'll start with Dr. Caldwell.
Good morning. I've been very impressed with the progressive increase in compliance of people wearing masks in public. And I believe in cooperation and communication with all our other team members that we've struck the right balance to assure that all of those who may have reasons why they shouldn't wear a mask can feel comfortable and not wear a mask. It's important, though, if you feel you have a medical condition and you feel you should not wear a mask, I would say please don't go out. Please wear a mask. You are probably more, talk to your doctor about it. If you think that you have a medical condition which you think your mask will impede you, talk to your doctor about it. If you have a medical condition, you really should be wearing the mask, but we don't want to impede you. Compliance is up. We're making progress. So please continue to help me wear a mask whenever you're out in public. Thank you.
Thank you, Damon, for your question. I think the answer on Lower Broadway, and it's true for the rest of the county, is that all options are on the table. We have a fragile but hopeful recovery going on right now. We need to protect that. We need to make sure that that continues. And if there's a problem with compliance and cooperation, that will be addressed. We want to get people back to normal, but the way to do it is for cooperation and compliance. And anybody who comes here who's not willing to follow our health orders, they need to be aware that that we're not going to put up with that. Thank you.
Kathleen Surrey at Fox 17.
Good morning. Thanks for taking our question. So yesterday, several media outlets, including ours, did a story about a bachelorette party coming into town over the weekend, went to a local restaurant and were disobeying some of those guidelines, trying to push tables together and not wearing masks. One of the women allegedly coughed on an employee. Can Mayor Cooper give any insight into how business owners or managers can enforce these types of rules when these types of things do happen, as they are not really 911 situations, so oftentimes an officer cannot respond right away? So I think business owners and managers are just kind of looking for a little guidance from the city. Thank you.
Thank you, Kathleen. Mayor Cooper.
Thank you, Kathleen. As all these owners probably would agree, this is bad behavior happens before there was coronavirus, and will happen on the other side of coronavirus. We want to make our city's resources available to these owners, particularly in this difficult thing of keeping their staff safe. I mean, there's always unacceptable behavior, sometimes by patrons, sometimes alcohol has promoted that. But there has to be a zero tolerance for actively trying to endanger or behave like you're endangering an employee of one of our valued businesses here. And so the owner of that establishment, I think, knows how to contact us and the police, and we would be happy to investigate, send a detective, and if the facts warrant more action on a reckless and an action attempting to recklessly endanger a valued worker here in Nashville's economy, we're going to protect that worker.
Brett Kelman at the Tennessean.
Good morning, everyone. It seems like there's two story threads that are happening right now. One, the city seems to be making measurable progress as a whole. And two, it appears to have tried but been unable to get a handle on Lower Broadway, where crowds continue unmasked and undistanced. How do you guys reconcile those two things? How are we gaining ground as a whole where Broadway, our most visible and impacting street, continues like normal? Like, how are these two things happening at once?
Yeah. Mayor Cooper.
Thank you, Brett. Dr. Jahanger may have a separate response. Well, we are making progress. The fact is that a lot of people in Lower Broadway may be testing positive and not showing up in our numbers. You know, they don't live here. Your test results are where you live. Now, we don't want them to get it either, but it is not fundamentally showing up in our test results. And I do feel that in the days ahead, we will try different strategies for trying to get more compliance. We don't want COVID to show up in these folks' home communities either. We don't want people to come here and spread it, even to people who are not from here, who are going to take it back into other locales. It is why we need regional protocols, I think, and I think the White House would agree with that very much, state and regional protocols. But again, it's not actually inconsistent because so many of the people in Lower Broadway are not showing up in our numbers. We will try to keep them safe too, despite some reluctance on their part. But it's not, again, but again, we in Nashville, our first job is to keep our folks safe. And that's going reasonably well a few weeks later after action, and it shows the value and the validity of these actions.
Thank you, Brett. Regarding how we're doing as a city, the second thread or the first thread, whichever way you want to look at it, you know, we hit our peak transmission rate on June 29th. And on June 27th, and then subsequently on July 3rd, we put the mask order in and the closure of bars. And really, the life cycle and a half, two life cycles, so about 2 to 4 weeks, is what we all expected if people were going to be compliant and follow this when we see these results. And we're starting to see that. You know, this weekend I went out on a little nature hike with my family, and it amazes me how many people are wearing masks now. I think we need to highlight the good that a lot of people in Nashville are doing. This is a community response. Nashville, from the beginnings of this whole thing, we talked about Nashville Strong. Remember, this was just a couple of weeks or two after the tornado, and the response we had then, that response continued. People in Nashville, a majority of them, are doing what we need as a community to get over this. And as the mayor highlighted, the community of Nashville is doing well, but our regional areas are starting to see increasing cases. And we need to, as a state and as a country, really focus on doing better. And I think we'll continue so we can get our kids back to school, so we can open up our economy. But everyone's got to be in, and I implore everyone to not listen to the fake science. I implore everyone to lean on your community members to keep doing what you're doing. That's really good. So anyway, I think that is, at the end of it, just to summarize, I'm just grateful for everyone in Nashville's doing, and that is why we're seeing the results we're seeing. And Dr. Hildreth would like to say something.
I would like to say that there's a third storyline playing out, not just here in Nashville, but over the whole country. It relates to something Ms. Gentry said. This comes down to personal responsibility and whether all of us are going to decide that we're going to play our part to stop this virus. And until and unless that happens, whether you're 30 years old, 3 years old, or 90 years old, we all own this problem, and it's not going to be solved unless all of us take responsibility for it and show respect for each other by not doing the kinds of things that we're witnessing. And that's a national problem. It's not a Nashville problem. It's not a Broadway problem. It's happening all over the country. So that's the third storyline that's playing out, is whether or not, especially young people, will make the choice to help us defeat the virus.
Stacey Case at Fox 17, you're on the air.
Thank you. How much of Nashville's CARES Act allocation is left for disbursement, and will any of it be used to help small businesses stay afloat?
Thank you, Stacey. Mayor Cooper.
Thank you, Stacey. If I heard your question correctly, it's about the CARES Act allocation, and will any of it come to small business? I hope so. The council, and we together have a very fine committee to make recommendations that I think is actively working hard. Small business relief resources are going to be greater from the state and the federal government. What exactly the state is providing with its original CARES Act money, I think it is working through now. I mean, it's started out with a pot of measured in the billions of dollars. And then secondly, there's a question of, is there any additional federal response that's going to be targeted to businesses? I mean, this is the sharpest recession, have said this from the beginning, in my lifetime. A response is certainly appropriate. What we don't know is what are the resources available for appropriate response. The indecision by the federal government on the next phase of CARES funding ultimately is a critical matter to small business. But fundamentally, that is where the resources are. What could conceivably be available from Nashville through our little sliver of CARES money would be measured in the single or the tens of millions of dollars. That's really a drop in the bucket in what's available through the state and the federal path.
Our last question today is from Carice Jackman at WSMV. Carice.
Yes, good morning, everyone. Thank you for taking my questions. I have two questions for you. One, have there been a history of complaints or calls to this East Nashville party location before or against the organizers? And are the organizers cooperating with the mayor's office in your investigation? And then number two, I know that the Community Oversight Board sent out a list of recommendations when it comes to searching for the city's next police chief. Officials with the board told me that they have not heard back from the mayor's office. So is the Oversight Board involved at all in this search? And have you been communicating with them? And then how is the search going? I know you sent out your outline last week, but how is the search going so far? Thank you so much.
Carice, in regard to your first question, we're considering that a criminal investigation, so we're going to withhold any further comment on the matter. And then in terms of your second question, I'll refer that to Mayor Cooper.
Well, thank you. I think there'll be a lot of more announcements this week on the chief search progress and also the evaluation of our policing use of force and policies this week. I myself have been in touch with the chair of the COB. They're fundamentally involved in this. So I'm a little surprised at the question, but there'll be a wide involvement by a lot of people from Nashville in this process. And I'm excited about this moment that we have to take our fine department and make it even better as we create a great platform in the 21st century for public safety and visioning it broadly.
Those are all the questions we have this morning. I'd like to thank Dr. James Hildreth, Mr. Bob Cooper, and Ms. Taylor Gentry for joining us today. The next scheduled Metro COVID-19 press briefing will air on Thursday, August 6th at 9:30 a.m. Thank you for joining us. This concludes today's event.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.